Hello guys, welcome to the Med Concepts with Bhavya, and today we are going to talk about the radius bone anatomy, attachments and the clinical anatomy. This is going to be the last part of the radius bone anatomy, and this is going to be the last video of the upper limb bones, and after this we will be going for the lower limb bones. So without any delay, let's get into the video. So in this video we are first going to talk about all the attachments, that is all the insertions, origins and ligament attachments of the radius bone. Then we will be talking about the clinical anatomy that is related to the radius bone. So first let me tell you the color again so that you will not get confused. The blue color would be for the insertion of the muscles, the red color is for the origin of the muscles, and the green color depicts your ligament attachment. So first let's go through the blue color, that is the insertion of muscles in the radius bone, and then we will talk about the origin and the ligaments. See, first of all, you should know the features very well so as to understand the attachments of the radius bone. Why? Because in every feature you will have some certain attachments, so you have to be very well aware of the parts of the bone, and then only you can be very clear with the attachments. Now let us talk about the insertions on the radius bone. Insertions are in blue color. Okay, I have marked them in blue color. So the first one that you see is, first of all, you have 5 insertions in the radius bone. So the first one that you see here is the biceps brachii. Okay, so the biceps brachii, I told you this part, this round part, what is it? This is the radial tuberosity, right? So we would see here that the biceps brachii gets inserted into the posterior rough part of the radial tuberosity. See, this round is the radial tuberosity. This part is the radial tuberosity, and in the posterior rough part we have the insertion of the biceps brachii. Now let us flip into the lateral surface, that is the surface between the posterior border and the anterior border, and here we will see 3 insertions, 3 muscle insertions, that is 1, 2 and 3. So let us talk about the first one, that is the supinator. Now the supinator is inserted. See, this is the lateral part, that is the lateral surface. I meant the lateral surface. This is the lateral surface. Let's divide this surface into upper part, middle part and lower part. Okay, so in upper part we have the insertion of the supinator. In the middle part we have the insertion of the pronator teres, and in the lower part we have the insertion of the brachioradialis. Again repeating, in the lateral surface we will divide the lateral surface into 3 parts for learning the insertions. The first one, that is in the upper part, will be the supinator insertion. The middle part would be the pronator teres insertion, and the brachioradialis would be inserted into the lower part. That is all about the insertion in the lateral surface. Now let us move back again to the anterior surface, that is the anterior view. This is the anterior surface, that is between the anterior border and the interosseous or medial border. In this we have our last attachment, that is the last insertion, that is the 5th one, which is the pronator quadratus. So pronator quadratus is inserted into the lowest part of the anterior surface. This is the anterior surface, and the pronator quadratus is inserted into the lowest part of the anterior surface. So this is all about the insertion. Now let us talk about the origins that are in red colors. We have totally 4 origins in the radius bone. Here let us divide the origins into 2 surfaces. We have 2 muscles originating from the anterior surface and 2 muscles originating from the posterior surface. So let's talk about the anterior surface first. The first muscle that you will see here is the flexor digitorum superficialis, which you can remember as the FDS muscle. This is the reason why I told you to remember the features very properly, because you have the muscles attached into particular sequence and particular features. Okay, so now we talked about anterior oblique line in the features, right? So in the anterior oblique line we will have the origin of the flexor digitorum superficialis, this one. So flexor digitorum superficialis is getting originated from the anterior oblique line of the anterior border. And the next muscle that we see in the anterior surface is this one. See this one. This is the flexor pollicis longus, that is the FPL. The FPL, that is the flexor pollicis longus, gets originated from the 2/3 of the anterior surface, that is upper 2/3. Okay, so upper 2/3 of the anterior surface you will have flexor pollicis longus, and in the anterior oblique line you will have the origin of the flexor digitorum superficialis. Now let us flip the bone to the posterior surface, that is this one. So in the posterior surface we have two muscles getting originated. The first one is the abductor pollicis longus and the second one is the extensor pollicis brevis. Okay, both of them are arising or originating from the posterior surface. The upper one will be the abductor pollicis longus and the lower one will be the extensor pollicis brevis. Now how you can remember it is, you can just remember that A alphabet comes before E alphabet, so A will come above the E alphabet. So we can say that the abductor pollicis longus is originating from the upper part of the posterior surface, that is this one, and the extensor pollicis brevis is arising from the lower part of the posterior surface. So that is all about the origin and insertion. And now we will talk about the ligaments that are attached to the radius bone. Now let us talk about the accessory structures attachment, that is we will have a cord, we will have a ligament, we will have a membrane, and we will have a retinaculum. So first talking about the ligament, we will have the quadrate ligament that is attached in the medial part of the neck of the radius. See, this is the medial part, right? So in the medial part of the neck of the radius we will have the attachment of the quadrate ligament. See, marked in green. Then the second one would be the oblique cord. The oblique cord is this one. See, this green one, this circle. The oblique cord is attached on the medial side just below the radial tuberosity. So the first one was ligament, the quadrate ligament in the medial side of the neck, and the oblique cord we saw, the second one, that is in the medial side just below the radial tuberosity. The third one is the interosseous membrane, which I did not mark because I already had origin and insertion marked here. That is the membrane, which is the interosseous membrane. I told you in the features video that this is called as interosseous border or medial border because it is consisting of interosseous membrane attached to it, right? That is why it is known as the interosseous border. So we have interosseous connection here. Interosseous membrane is attached here into the lower 3/4 of the bone. This interosseous membrane here would be attached and will be attaching the ulna with the radius so that there is smooth movement while pronation and supination. So that is the third one. And the last one that we see would be the extensor retinaculum. Extensor retinaculum is something that keeps all the extensors of our wrist intact, right? In the wrist we have an extensor retinaculum which keeps all the extensors intact in their places, right? That extensor retinaculum attaches to the lower part of the sharp anterior border. So we have seen 4 accessory structure attachment: the quadrate ligament in the medial side of the neck, the oblique cord in the medial side just below the radial tuberosity, the interosseous membrane would be there in the lower 3/4 of the radius medial border, and the last one would be the extensor retinaculum in the lowest part of the sharp anterior border. So that is all about the attachments, and now we will be going through the clinical anatomy related to the radius bone. Okay, so in the clinical anatomy we will see 2 fractures. One is the Colles fracture and another one is the Smith's fracture. Okay, in the Colles fracture what do we notice is Colles fracture occurs in the distal end. Okay, see, both Smith's fracture and Colles fracture occur in the lower end only, that is the distal end only. But what is the difference is, in Colles fracture you will have the fracture just above 2 cm of the lower end of the radius, like this. This is the fracture you can see here, this one. See, here you will have the fracture in the distal end, and what happens here is the radius broken part, that is the distal fragment which is being separated because of fracture, will be moving upwards and backwards. Okay, so this part which is being fractured and which is being moved away from the part of the radius bone would be moving upwards and backwards. So this is your Colles fracture. Now how does this happen is, This happens because of falling on the outstretched hand. Now next, talking about the Smith's fracture. You can see here in the diagram, this is also the fracture of the distal end of the radius, but in this the distal end moves backwards, that is anteriorly. That is why this is the Smith's fracture. So Smith's fracture, you will have the movement of the distal fragment downwards, whereas in the Colles fracture you will have the movement of the distal fragment, that is displacement of the distal fragment upwards. Okay, now here what happens is, see, what is one more difference here is, in the Colles fracture the wrist is in extended position while falling, whereas in Smith's fracture the wrist is in flexed position while falling. So in clear words, what we can say is, Colles fracture occurs due to fall on outstretched hand when the wrist is extended. So we fall on the extended wrist. Okay. Whereas in Smith's fracture, we fall on the flexed wrist. So that is the difference between the two fractures. Third and the last clinical anatomy that we see is the pulled elbow. The pulled elbow is also known as the subluxation of the head of the radius. Okay, that is displacement of the head of the radius, and it is also known as nursemaid's elbow. That is nursemaid's elbow. Okay, now how it is happening is, it is happening due to the subluxation of the head of the radius. The cause for the pulled elbow is the head of the radius. What happens to the head of the radius is, it dislodges, that is, it is removed from the attachment of the annular ligament. Okay, it is being kept intact in position by the annular ligament, but while pulled elbow occurs, what happens is the head of the radius dislodges from the grip of the annular ligament. This is commonly seen in children under the age of 5. Okay, so this is the pulled elbow. Let me show you a diagram so that you are clear how it happens. If you see in this book, see, the lady is just playing with the baby and she's carrying him this way. She's pulling her hand this way. So doing these type of things, when you don't have proper support to the bone or the joint, what happens here is, the radius head will dislodge from the annular ligament and you will see pulled elbow. Hey guys, this is all about the radius bone anatomy. We have studied today about the attachments, that is the origin, the insertion and the ligament attachments, or you can say the accessory structure attachments in the radius bone. Then we talked about the clinical anatomy, that is two types of fractures, Colles fracture and Smith's fracture, and the differences between the two fractures, and then the third one, that is the pulled elbow. So we are done with the radius bone anatomy, and we are also done with the upper limb bone anatomy. I know in upper limb we also have carpals, metacarpals and finger joints, but I don't have those bones, so I can't take those videos. That is why we will directly go to the lower limb anatomy, and we will be starting with the lower limb bone anatomy, that is the osteology of the lower limb. And that is all about this video. I hope it was clear. If there was any queries, please comment down in the comment section below. Also, notes would be uploaded on my Instagram page, and the link to my Instagram page would be somewhere here, and also it would be there in the comment section below. Please go and check out the notes. Yeah, I have also opened a Telegram channel for uploading the PDFs of my note. I will also update the link of my Tele channel here. You can join there for free and easy accessible notes. That is all for today. Stay home, stay safe. As always, like, share and subscribe. Keep watching and be safe.